So this is Bucca's dream team here at the University of Florida Small Animal Clinic. That's what I should
Dream
say.
team, sure. I think we should keep that.
Introduce yourselves.
I'm Dr. Lindsay Hockman.
I'm Audrey Guida. I'm a student. I'm Dr. Christina Montalbano.
Awesome. And you guys actually know Dr. Sherman Knapp.
Yeah, we do. We know the name. We've never met personally, but obviously we've read a lot of his book chapters.
Awesome. Well, listen, I
Yeah.
appreciate you guys taking a look at Bucca. As you know, she's dealing with a mast cell tumor in her mouth.
Yeah.
What do you think? I know we've been doing the clindamycin, the steroids, the
Yeah.
Benadryl.
So I think all of those are a good idea to continue. Obviously, we don't know if it's infected or not, but just in case, the clindamycin is probably a good idea to just keep
Okay.
going with. The Benadryl is for the histamine. I think that's also wise, especially for dogs with mast cell disease. We can continue on that for a period of time, depending on if they find any other locations. We'll probably look in our abdomen as well when they come in for oncology visit too. So
In a nutshell, how do you explain to people what a mast cell tumor is?
it's kind of a tumor of a certain white blood cell that basically controls a lot of itchiness. We talked about mosquito bites. So it's a special cell with a lot of purple dots in it. And basically when it gets activated, it releases all those purple dots, and that releases a lot of inflammatory mediators, essentially, that make you pretty itchy or swollen and bloody, as you can see in this case.
Okay. So what are you going to recommend in the sense of what can we add to it from the holistic side, right?
So yeah, at this point, we're recommending Yunnan Baiyao, and basically what this does is it controls bleeding. So it's a Chinese herbal supplement. Basically the translation is white powder from the Yunnan province in China.
Okay. Is that
so
topical or oral?
It's both. So we're going to recommend an oral supplementation as well as topical. So I can actually show you how to put it on. It's not going to be super easy, just because I know she's very wary about us touching that area, but it's
Okay.
probably no
But you're gonna
different
do
than
the first application, then,
Yeah,
right?
we'll do the first one. Yeah, it's a capsule, so you can just open it up, and then there's the powder inside.
Okay, cool.
So you can throw out the gelatin capsule. Hi. Hi, sweet lady.
And how often do you recommend I could put that into her food?
So you can put the capsule itself, she can eat with the gelatin on it. So you can put it in a little bit of peanut butter or something for her oral dose. For her topical dose, I would just do something similar to hopefully what's about to occur.
Good girl, Bucca. What a good girl. I know, sweetheart.
So I don't need the pad, just pour it on there maybe?
Yeah, I
Okay.
think that's fine. That might be the best way to not contact it, which is
Yeah.
the uncomfortable part for her. But that's it. It's stinky.
And how does that work compared to the other, like, what is it called, Stipicaine?
So it actually has this proprietary formula that's protected by the Chinese government. So to be completely honest with you, we don't actually know all of the ingredients of it, but there's been a lot of studies looking at the effects of Yunnan Baiyao on mostly platelet aggregation to stop bleeding.
Okay, well let's hope it works because I'm going to run out of Swifters. I'm going to take stock out on Swifters in my house.
We took some preliminary measurements today, so hopefully we can track it going forward. Seeing as you just started the steroid yesterday,
Yeah.
that might be the thing giving her the best chance at taking down a lot of that inflammation. So I would continue on the steroid for sure, the
Okay.
clindamycin in case there's an infection going on in there as well secondarily, and then the Benadryl. So the other things we're going to talk about, we're going to send you home with the Yunnan Baiyao for the bleeding, and that'll
Okay.
be both oral and topical. And you can stop this whenever the bleeding hopefully stops. So
Okay.
we gave you just some to start, but you can order it online going
Okay,
forward.
cool. Okay.
And then the other thing we were talking about was medicinal mushrooms. I'm going to give you a link to an Amazon page. We don't carry any of this in-house, but
Okay.
it's a mushroom combination blend, and essentially what it does with a variety of different tumor types is it helps arrest the cell cycle and kind of stop cancer proliferation, maybe control metastasis. So that'll be a helpful thing for her immune system and immunoregulation
Okay.
going forward. And then the other thing we talked about was the frankincense. And I know that's what Dr. Smallberg used for a case historically that seemed to be pretty successful. So there's not a lot of literature out there specifically with canine mast cell disease and frankincense, which is Boswellia serrata. So it comes from the resin of a tree essentially.
Okay.
And the active property is AKBA. So we can either find an AKBA concentrate that you can order online or Boswellia serrata. I'll give you the option to do either. It's just different dose ranges. So the paperwork I'll send you later will have all of that as well as links to purchase it online.
Sounds great. And if
So-
folks want to learn more about what you guys do here in the Integrative Health, is there a good website for people to find out more about what you guys do here?
There is. So I don't know it exactly. It should kind of detail all of us here in the service.
Sounds cool.
As well as our research interests and
So what's the mission? Let me rephrase it then. What is the mission of what you guys do here?
Kind of what we do is what the rest of the hospital can't offer specifically, essentially. So it's a little bit of a catch-all service where we offer some Western medicine techniques. Obviously, we do physical rehabilitation for animals that have suffered from neurologic disease or an orthopedic injury, or even geriatric animals that just need some physical rehab to get back on their feet again, or hopefully slow or maintain a disease process, usually arthritis. And then we obviously do acupuncture as well, some of the Eastern modalities to help control pain, sometimes side effects from chemotherapy, so it's possible we could do that for Bucca in the future. And then we recommend some herbal compounds. We have hyperbaric oxygen as well, so...
That's where East meets West.
A little bit, yeah. So we try to do whatever is in the best interest of the patient and just use each medicine as it's best suited for them.
Thank you so much. That's good.